How common is scoliosis? Scoliosis is the development of an unnatural sideways spinal curvature with rotation, and the rotation is typically into the concavity of the scoliosis, and this rotational component is what makes the condition a true three-dimensional problem. We know scoliosis is a progressive condition, meaning it is in its very nature to worsen over time. Now, what typically causes progression is going to be growth. Growth is by far the number one risk factor for progression during adolescent growth spurts. Progression means that the unnatural curvature increases its size. Now, there's no way to predict how much a curve will progress during growth, but we all know that this is the time that it's most likely going to progress. As scoliosis curve gets larger, we also know the condition and the way it affects the body also gets larger as well. So therefore, the effects also increase because of the uneven forces that are applied to the body. We also know as curves get larger, scoliosis becomes more complex to treat. And so therefore, the more severe scoliosis becomes, the less likely we are to get a significant amount of change or reduction because the spine gets increasingly more rigid as a result of the scoliosis worsening. Now, the Scoliosis Research Society has a current estimates that about 7 million people living in the United States have some type of scoliosis. Scoliosis is also the leading spinal condition among school-age children. And we know schools across the United States used to perform mandatory scoliosis screenings. However, that has changed. And now it's not really mandatory anymore. Some states actually have scoliosis screenings, other states don't. It's really unique to the state, even to the county, or even the school level in terms of whether they're going to perform a scoliosis screening or not. And there's many limitations on the scoliosis screenings because most of these scoliosis screenings are typically done at one time, meaning, and we know curves only worsen to become noticeable during growth, and not everybody grows at the exact same time. So if the person is screened before a growth spurt, it may be negative for a scoliosis screening, but if they're screened after the growth spurt, they may actually find it. So we believe a lot of patients are actually undiagnosed. And as a result of this abnormal or this bad version of scoliosis screenings, the shift of actually finding the problem is brought to the parents, to any caregivers, or actually the patients themselves noting any kind of asymmetry. Now, there are different types of scoliosis cases, and typically scoliosis is normally first classified by causation, meaning the majority of scoliosis are classified as something called idiopathic scoliosis, and this is where there's no associated single cause. This is by far the majority of cases of scoliosis diagnosis cases that occur. We believe this is about 80% of all cases of diagnosed scoliosis. Cases are roughly idiopathic, and this means no cause, and we believe it is a multifactorial problem. However, the other 20% are associated with known causes. Neuromuscular scoliosis, which is when a patient has a neuromuscular condition and they develop scoliosis. Degenerative scoliosis is when the spine is degenerating abnormally, typically diagnosed in older life as a result of the spine deteriorating abnormally, causing a scoliosis. And congenital is when you have an abnormal vertebra that's developed in utero that causes scoliosis at birth. So we have more than just idiopathic scoliosis by far. It's the largest type. The most common type of scoliosis people associate with is something called adolescent idiopathic scoliosis. This is the most common diagnosis that tends to happen with people associate with scoliosis, and this is when patients are diagnosed with scoliosis between the age of 10 and 18 years of age. Now, we believe that these patients that are diagnosed with adolescent scoliosis probably had scoliosis in their juvenile years, but there wasn't big enough for them to see it. And obviously, all of these adolescent cases move into the adult form, so at some point, they're going to become adult scoliosis because they're not going to stay between 10 and 18 years of age. But this is the most prevalent condition that we people associate with scoliosis is kids with scoliosis. And the reason why people associate scoliosis more common with adolescent, because this is the most common age for rapid progression that leads to surgical treatment, meaning as curves progress in this stage, they can lead to rapid progression during growth, this unpredictable progression during growth spurts, typically resulting during their pubescent growth spurts, can lead to progression. The progression normally leads to surgery. As curves progress and you move into the adult stage, they now start to progress very slowly. And as a result of this slow progression, there is normally not surgical intervention. So what ends up happening is that all the adolescent cases that are diagnosed move into the adult stage, but then all the undiagnosed adolescent cases that never became big enough move into the adult stage too. And those curves also progress, and they progress very slowly in the adult form. And so therefore, we start noticing that there's a bigger population because you start seeing these other curves start to progress. And then then we have all the adult onset cases. So the largest group of patients with scoliosis isn't actually adolescent kids. It's actually older adults. And we know that every decade of life, when you go from 10 to 20, we have a certain percentage, to say 5 to 7% of patients are diagnosed or kids have scoliosis. Every decade of life, that number gets larger. So between 10 and 20, we consider there'll be more like 10 to 15% of patients have scoliosis. And it continues to climb to where patients over 60 to 70 years of age, we believe somewhere between 30 to 50% of patients in that age group have scoliosis. So the most common group with scoliosis is going to be your older adult. But for whatever reason, we only associate it with adolescents because this is when surgery is done. Normally, surgery is not done for patients in there as an older adult because the surgery is so complicated, it's going to lead to a negative effect in performing the surgery. So most adult patients are normally not treated. They're just saying, don't worry about it. It's going to worsen. In fact, a lot of times they're told it's not going to even worsen. And that's untrue. We know curves do worsen, and they're just pushed on because there's really no treatment for scoliosis in the adult form until it becomes so severe that the patient is willing to undergo a risky surgery, which has a poor prognosis. And most surgeons don't want to do that, so they normally it's pushed off. So the most common group is older adults, but it's most associated with teenagers. Now, scoliosis, unfortunately, is not curable. It's an uncurable condition, no matter if you find it as an adolescent, you find it as a young adult, or you find it as a late stage adult life. However, we do know if you diagnose it early, that's only going to really help if you treat it early. So treating a scoliosis can give us a better result in producing a result for the patient that they'll never progress to where they need a surgical intervention. So there's less limits on what can be achieved that if you diagnose it early and you treat it early. Very often, small curves could be diagnosed, but then they're never treated. And then the curves progress and into a more severe condition, and now the treating it becomes much more difficult. So because we know scoliosis is a progressive condition in any stage, in adolescent, adult, or late stage life, we know treating scoliosis as soon as you diagnose it and managing scoliosis over your entire life is by far going to lead to the best possible outcome. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.